I'd like to welcome everyone to our first Take Five with Frank, where we're going to try and do a collection of a video series and meetings with some community leaders, small business owners. We're going to talk to law enforcement. We're going to talk to legislators. I just think this is a great way to get out, clearly in this environment that we're in, just to try and give someone a little bit of insight, give you folks a little bit of insight, not just into the campaign, but really what's going on in our community. A couple of points here. We're going to have everyone muted at this point, just to keep the cheering down to a minimum. And at the end, we're going to open it up to some questions. But the questions that we've gotten in over the course of the last 3 or 4 days. So we'll let Dr. Mazzola speak, and then we'll just read off a few of the questions that we've received over the last few days. Before we get started, I do want to kind of reach out and have the campaign express our thoughts and concerns for those that are suffering through this crisis. Obviously, this was unprecedented, and we know people are suffering, and we just want to let you know that our thoughts and prayers are with all of you. As you can see, Catherine Mazzola, Dr. Catherine Mazzola is going to be our first guest. She's going to talk a bit about clearly the COVID crisis itself, but she's going to branch out a little bit and talk through some numbers and give you some insight as to what she's not just seeing now, but some insight as to where she sees this COVID crisis going, and give you a little bit of insight, I believe, into what she's hearing out of DC. So just as by way of introduction, Dr. Mazzola is an experienced pediatric neurosurgeon. She's certified by the American Board of Neurological Surgeons and the American Board of Pediatric Neurological Surgery. She specializes in traumatic brain injury and concussion, pediatric brain tumors, spine tumors, and brain cysts. Dr. Mazzola serves Morristown Medical Center on the Operating Room Committee, Medical Executive Committee, and she is a member at large of the Morris County Medical Society Executive Board. Dr. Mazzola, like me, grew up in Queens, New York, and currently lives with her husband and 5 children in northern New Jersey. So Dr. Mazzola is going to obviously take some time here and talk to you. There will be a PowerPoint presentation that she may pop on and speak through. So without any further ado, Dr. Mazzola, I appreciate your time. Thank you so much.
Oh, you're very welcome. You're very welcome. So thanks for inviting me to speak tonight. Frank told you a little bit about me. I did grow up in Queens. I went to New Jersey Med School in Rutgers, New Jersey, in Newark. And I did my residency there, my neurosurgery residency. And since 2002, I've been a practicing neurosurgeon in New Jersey. So I'm going to share with you some information about what's going on with the COVID situation right now. And so I did put together a little PowerPoint presentation. So I will show it to you now. And then after that, we can talk about some questions, do some questions and answers. So going over what's been going on, I obviously have no conflict of interest, all the disclosures, who I am and what I do, Frank already mentioned to you. Most of the information that you need to know as people in the general public, NewJersey.gov has a COVID-19 dashboard. And this is an important fact sheet for you to know. Currently, we have 99,989 positive cases in New Jersey. Compared to where we were at the end of March, you can see this number more than quadrupled. And the deaths, at the end of March, we had 200 people who had passed away in New Jersey with COVID-related illnesses. Now, unfortunately, over 5,368 people have passed away to date. So we're currently experiencing a 44.4% positive test rate, and there are over 30 test centers that are currently in action throughout New Jersey, and there are different counties. All the available COVID testing centers are listed on the nj.gov website if you're interested. This is where we are today as far as COVID patients. So we have about 7,240 people who have been hospitalized because of COVID. And when you look at those people, about anywhere from 20 to 30% of them are currently intubated or on a ventilator. And this is because the COVID virus causes a pneumonia, which decreases oxygenation. So many of these patients end up in critical care or intensive care facilities, and they're keeping our hospitals full and bringing the census rates up to levels we've never experienced before in New Jersey. At long-term care facilities, we've seen over 13,000 cases. These are mostly skilled nursing facilities or nursing homes for the elderly. So unfortunately, where you have a high population density, you'll see an increased density of COVID cases in those facilities. If you look at COVID-19 deaths, you can see how it's broken down by ethnicity here. And the ethnicity breakdown really represents the population throughout New Jersey. What we've experienced in many of the hospitals in New Jersey is that the significant part of the death rate is really coming from those 80 years old or older. So you can see in the bottom left-hand part of the slide here, again, of the deaths that we've seen in New Jersey, over 2,300 of them are in the elderly. And many of these patients have cardiovascular disease, diabetes, chronic lung disease, or other medical problems. And all of this data is updated on a daily basis on the nj.gov COVID-19 dashboard. And this was pulled off of there today. You know, we're pretty certain the virus originated out of Wuhan, and there's evidence to that. And right now, this is where we are in New Jersey with about 100,000 cases, over 5,000 deaths, and a positive test rate of about 44%. So let me do this. So you can go back to the regular, okay, got it, stop share. So, you know, the virus and the effects of the virus, you know, we started seeing them in the United States at the end of January. However, it wasn't until mid to late February that I think our government and New Jersey realized the extent of the pandemic. So many of the regulations that we're living under right now were really only started in mid-March. It's been about 4 weeks, and it's been 4 really hard weeks. It's hard for physicians, nurses, frontliners, hospitals. It's been rough for all of us, people who own small businesses, you know, and the medical practices are small businesses. So I think everyone's been dealing with the stress and the strain of the COVID pandemic. I think everyone is doing the best that they can right now. My life has changed dramatically. All the hospitals in New Jersey, under state mandate, closed down the elective OR schedule, which means children who were going to have elective neurosurgical procedures, all of those surgeries were canceled. So in effect, we haven't done any pediatric neurosurgical cases in about 4 weeks. The reason why is because they're using all the ventilators for COVID patients. So the operating rooms, which were obviously used to do surgeries, are now being used as intensive care rooms, and there are patients being kept in the rooms on ventilators. So many of the hospitals have repurposed the doctors and the nurses who used to do pediatric cases, and we're now taking care of adults. I'm very involved, not just at the hospital level at Morristown on the medical executive committee. I'm also on the Morris County Medical Society board, and I'm on our state medical society board. So I'm on the board at the Medical Society of New Jersey. I'm also really involved in the pediatric neurosurgical section and the American Association of Neurological Surgeons. So ever since mid-March, I've been participating in about 1 or 2 webinars a day, plus the webinars that I'm listening to through the Small Business Association, through SCORE, and through the women's division of SCORE. So I think from a local and a regional and a state level, we're doing a really good job. But let's face it, we're just trying to catch up. No one knew that this pandemic was coming. It sort of came out of nowhere. So that the supplies that we needed, the alcohol hand sanitizer, the face masks, the gloves, the surgical gowns, we didn't have as a community the stockpiles that we needed to protect many of our frontline healthcare workers from the pandemic. So, unfortunately, many healthcare workers and frontliners have been exposed to COVID. Some have tested positive, some have been hospitalized with COVID, and some have even passed away, secondary to the effects of COVID. So, this has been a learning experience for all of us. So, and we're still going through it. And I think we're going to be feeling the effects of the COVID pandemic for the next several months, if not the next year or two. So, on that happy note, what else can I tell you, Frank?
Well, look, obviously, Dr. Mazzola, I think everyone appreciates you taking the time. A lot of people here know you, and they know your schedule is pretty full 24/7.
Mhm.
It was 23/7 before the crisis, so I'm glad you found the extra hour to save the world. But this was incredibly helpful. You can imagine, not just being out on the campaign trail, but everywhere you turn, you're hearing, people talking, and there's all these different stories, and some of them are heartbreaking. Some of them are more, inquisitive about when we open up and how we open up. And I've actually, there were quite a few questions about opening it up. I'll just grab one now that we got early on, if you wouldn't mind. One of the questions were: residents are hearing conflicting advice as to the current status of the COVID-19 curve. Some sources advise that we are still approaching the apex, while others state that we're almost ready to open businesses back up. From a purely medical standpoint, when do you think we might be able to return to some sense of normalcy in our area? And what do you think that'll look like, both after we turn things on and going forward?
So I think it's really going to be a staged, gradual reopening and reintroduction to normal. One of the things that has to happen is we have to increase the amount of COVID testing. Right now, we just don't have the number of tests available to start testing asymptomatic people walking around like you and me who have no cold symptoms, no fever. Should we all get tested? Probably yes. But in order to do that, we need to increase our testing. Right now, we're doing about 8,000 COVID tests a day. And it's been estimated in New Jersey alone, we should be doing about 25,000 tests a day in order to test our population. And then once you have an active COVID viral infection, obviously the self isolation and social distancing is so, so important. But to know that you're negative, you can let your guard down a little bit, but until we really not just see a flattening of the curve, but we see a significant decrease in the high positivity rate, we're all going to have to protect ourselves by wearing surgical masks or some kind of facial covering, whether it's a bandana or a scarf, when we go out in public. So unfortunately, I think our Memorial Day parties are not going to be happening this year. Possibly a little bit more normal by July 4th, Independence Day. And I'm hoping as we go through the summer that the positivity rate really goes down to like 1 or 2%. But right now, we're still only testing symptomatic people. And so we still have more catch up to do in that area.
Okay, I appreciate it. Another question we had heard earlier, and this seems to be the one I hear a lot of conflicting thoughts around, is the mortality rate. I think you're seeing, I don't want to say people playing with it, but you're seeing movement both in the numerator and the denominator, which obviously affect the mortality rate a great deal. In your personal view, do you have any thoughts, or the medical community have any thoughts as to what the true mortality rate is when you take into account the people who had the disease or had the virus and then were cured, people who were asymptomatic. Is there any thought around that, Dr. Mazzola?
Right. Yeah. So, I mean, if you look at our positive rate, right? So we have 100,000 people right now, for example, are positive in New Jersey, and we've had about 5,000 deaths, right? So basically 5 in 100. We have a 5% death rate. But if you look at that 5% death rate number, and then you look at that graph I showed you guys before, over 2,000 deaths were in those people over 80 years old. So if you take out that population, then your death rate is more like 1 to 2% in younger adults. So unfortunately, it's really the older people where the COVID pneumonia is so lethal, and it's because many of the older folks have other diseases like chronic lung disease, asthma, diabetes, hypertension. So unfortunately for your older adults or debilitated patients, they're the ones who unfortunately have a really high death rate.
You had touched on something earlier when you mentioned the response from the administration. One of the questions we had was, as an experienced medical professional, what is your take on the response of the White House and the administration to the current corona crisis?
Right. Well, in the beginning, if you can think back to late January and early February, I remember being in a neurosurgery meeting at the end of January, and they were just talking about, this strange virus in China. And no one really was thinking this virus was going to even come to the United States. And, when the president, closed down the borders to China, little did we know how many people are already coming into the United States who are carriers of the virus. I mean, this is a really difficult thing. So I think the government, did the best job possible. I think the PPP money, they just increased this week the expenditure from 350 billion to 670 billion dollars. I'm like, this is totally unprecedented. We've never seen this before. We've never seen a 20% unemployment rate. In the last 2 weeks, we've had 25 million people go on unemployment. This is unheard of. So the economic injury disaster loan, which is, in part sponsored by the Small Business Administration, or it's going to be administered through the SBA, that combined with some more financing for health and human services to the hospitals and to big, medical clinics, I think that's really going to help. So I think our government is doing as good of a job as they can right now. I was listening to the news on my way home from work the other day, and Como said something, Governor Como, he said, this is really, Trump's job, my job, it's thankless right now. Because no matter how much we do, people are just looking, saying, why didn't you do more? You should have done more, And then it's true. You want our government to do more. That, I think they're doing the best they can with the extent of the pandemic.
Yeah, agreed. I mean, just for some perspective, you threw out this second wave of 800 and some odd or 600 and some odd billion. We're close to 3 trillion right now, and I don't think it's over yet. I lived through the financial crisis, and that total spend overall was unprecedented at 800 billion, I think. So this is 4 times that, and we still haven't seen an end to it. So, we are certainly in uncharted waters. Another question we had is there's been an overwhelming amount of grassroots support for our medical and healthcare professionals, including communities setting up local groups to coordinate meal donations to hospital staff and first responders. Can you speak briefly about how our listeners could help out if given the opportunity?
Well, I think our hospitals, from Valley Hospital to Holy Name to Hackensack to Morristown, St. Joe's, Overlook University in Newark, St. Barnabas, everyone has really stepped up to the plate and is doing their best to help care for COVID patients. So many of the physicians are working extra hours, nurses are doubling up on their shifts. And the protective equipment we need to protect ourselves as healthcare providers from the COVID virus, that has been in short supply. So you see people doing creative things. Many people have started sewing groups, making face masks to cover the surgical masks. The N95 respirators are really to be used when you're going into a room of a patient with COVID and you know it's a COVID exposure. So there's so many good people and good organizations who have really stepped up to help people in light of the pandemic. If I would recommend anything, just go to your local government, ask them who in your town needs help, whether it's the first responders and the paramedics. Do they need help answering the phones? Are there older people in your community who need support from like Meals on Wheels? There's a friend of mine who owns the barn in Wyckoff, and he's providing meals to older citizens who can't get out. So if you have a teenager who can help deliver meals, that's a great thing, you know. And so whether you're talking about kids who are volunteering by making masks or teenagers who are delivering meals to people who can't get out of their houses, this is the time to reach out to your neighbor and say, hey, if you can't go to the grocery store, I have to go anyway. What do you need? I can buy it. I can drop it off on your stoop. Wave to me and we're good. Any way you can volunteer, it all adds up. So at the end of this, let's hope maybe by the middle of the summer, we can all have a big party.
At your house?
You got it. You got it.
Excellent. Hey, I had my own question, and it kind of goes back to what I've looked at. My I like to look at trends in the economy. Obviously, this has been a huge burden on the first responders and particularly the medical community as well. Do you see any longer term or medium term trends on younger people and how they're viewing the medical field, whether it's in nursing or whether it's a doctor? Do you have any thoughts on where people are viewing this after something like this?
Right. So, I think many people now realize how important physicians and nurses and scientists are. And it's really sad that so many young people are very focused and interested in making a quick buck and going into business. I think, there's something to be said, and they should consider a career in medicine or in science. I mean, every day I work with patients and their families, and that is one of the most beautiful and rewarding things that I do, helping a child, helping their family. And, I hope more young people are inspired to go into medicine or science, by this and by the response to this. The other thing I wanted to bring up, Frank, that I think is important to think about as a community, and this is, you grew up in Queens, I grew up in Queens, and in New York City, you have the New York City Police Department, the New York City Fire Department, the ambulance people there. In New Jersey, especially, in Bergen County and many of the counties, each town has a volunteer ambulance squad, the volunteer police, not the police department, but the ambulance squad and the fire department, and as our population density and many of these small towns grow, as the density of cities in New Jersey grows, we need to do a better job of organizing and funding our ambulance and our first responders, because we just don't have the resources that we need to take care of people. We need to be able to provide adequate response times for emergencies like this. When the number of calls you get to an ambulance squad, quadruples overnight. And we just don't have enough people who are volunteer ambulance drivers, volunteer paramedics. We just don't have that. So I think many of these towns, locally are going to have to rethink, their plan, because this pandemic can happen again. This was a very bad, failed science experiment. This was horrible. The COVID virus has been around, not the COVID virus, the coronavirus has been around for many, many years. But this form of it, whether it was, man-made or nature-made, who knows? But this is more virulent than anything we've seen before. So what about if next year there's another strain that of virus that comes out, right? Now that we know it can happen, we have to stockpile the PPE. We have to have those first responders available. We have to have a staff scheduling so we know we can support this kind of medical response if it's needed again.
Sure. Sure. Well, I know you had a hard stop, Dr. Mazzola, at 7 o'clock. I want to thank you so much for your time and your insight. I know everyone on here is found this very informative. A lot of people, like I said, have seen you speak in a lot of different events. I'm guessing not just because this is so wonderful of me doing it, but I think you're going to get a lot of people who are going to be ringing your phone off the hook.
Uh, I I used to have two Facebook pages, a friends and family page and a business Facebook page. One of the older neurosurgeons thought someone hacked me, so he sent an email to Facebook, and they shut down my friends and family page. So this started right in the beginning of the pandemic. So I've been without my Facebook friends and family page for a month, which is even more stressful. But you can friend me on my business, my professional page. I usually put a lot of medical information about the COVID virus testing centers on my Facebook business page. But I'm always here. If you need to call, if you have a question, you can just call the office.
Great, great. Dr. Mazzola, thank you so much for your time. And if
You're
anyone,
very welcome. Everyone stay well. Keep covered when you're out in public. Use your alcohol, hand sanitizers. Wash your hands for over 20 seconds and be safe.
all right. Thank you so much. I appreciate it. Thank you, everyone, for joining us. We'll give you
Take
more
care.
with the next one that we're going to be rolling out soon. Thank you. Bye now.
Take care. Bye.